Hi everyone, my name is Courtney from Inline Physio at Sanford. I'm here today to give you a talk about the difference between dry needling and acupuncture and ask you a couple of questions about questions that I get asked all the time about it. So what does it do, does it hurt, and how can it help you with your rehab? So acupuncture is part of a traditional Chinese medicine involved placing needles into points called acupoints into specific locations. The theory is that there are areas of potential imbalance, and acupuncture into these points is meant to restore energy flow. Dry needling is a bit different. It's known as Western dry needling or Western medical acupuncture. It's a skilled intervention where we use a thin needle to penetrate the skin and muscles to elicit a trigger point, a local twitch into a trigger point. So what does it do? A trigger point is a point in a muscle where you feel a bit of pain or tenderness or a knot sort of feeling. And a common area is on the shoulders. So when you're stressed or you're sitting at a computer, you might feel a knotty spot there. So dry needling works in a few different ways in the body. A local effect is that when we insert the needle, it stimulates nerve fibers in the skin and the muscle, and can often cause a little twitch in that muscle. And also you'll get some redness, so that's erythema, and it's a release of neuropeptides and histamine that your body naturally has. And then it increases blood flow and helps your body produce a natural response to injury and help natural healing. And then it can also block pain. So your brain often sends pain messages to that area when it wants you to pay attention to it. But when we want to rehab and get you out of that painful position, we can use the dry needling to block that pain message to get you better faster. And then there's also a chemical pain relief where it can give you release chemicals in your body that are a similar pain relief as opioids. People ask me if it hurts. Basically, it feels like a little pinprick sensation into the skin layer, and then once it gets into the muscle, you might feel a little deep ache as if I were to press onto a bruise. Sometimes you can get a bruise, but it's not very common, but that's nothing to be worried about. Sometimes you can have delayed pain after 12 to 24 hours. That's normal, and that will go away. How can it aid your rehab? Dry needling is most beneficial when it's used with your rehab program. So if your pain is a result of a posture or a biomechanical problem that the physio will assess, this is the source of the problem. The dry needling just helps aid in the process of the rehab. That's all from me today. Have a good day, guys, and I'll see you around.